Hi, friends. Welcome back to the FriedEggs Podcast. Amy and I are so excited for today's episode with one of my longtime friends, Ali Ramos. Ali lives in Costa Rica, where she's a nutritional therapy practitioner and the founder of Nueva Rama Wellness. Her story includes a long journey with clinical anxiety, depression, and endometriosis. After a male factor infertility diagnosis and discovering a cystic fibrosis gene mutation through PGT-M testing, her and her husband, Chris, went through 2 rounds of IVF in Costa Rica, and they are now pregnant with their first child. Today's episode includes a lot of amazing topics, including discussion of pregnancy after IVF. Please be gentle with yourself as you listen, and know that Amy and I are sending you all so much love. Enjoy the show. Hello. Ali, meet Amy, and also, I don't think we've actually, we voice note and everything, but I don't think we've actually, seen each other's face.
Since high school, probably,
yeah.
I think, maybe.
Oh my gosh.
I was trying to fill Amy in, and I think I remembered it correctly because she was like, how do you actually know Ali? And I was like, we went to high school together for a year before I moved to Colorado, but I couldn't remember how we reconnected. And then I think it's because you reached out because we had traveled the year before you, and then you and Chris were going to travel, right?
Yeah, I think that it was something about Southeast Asia. I feel like I asked you something about Southeast Asia or something. Or it was something to do with, for sure, about traveling. Yeah, for sure.
And now you live in Costa Rica, and now we have a lot of things in common.
Yeah, for sure. Some unfortunate, but definitely a lot. Yeah.
Where are you living in Costa Rica?
So I live on the very South Caribbean side, almost to the Panama border. So the side less traveled.
Okay. Yeah.
Cool. Depending on the day, 5 to 6 hours from the main city that you fly into.
Okay.
So again, depending on the day, because it's really not distance wise. It's driving from Sacramento to San Francisco, actually less than that.
Okay.
But it's one highway and it's the jungle highway. So it just depends on the day.
And you guys don't have a car, right? Do you have an actual, no, you just take public transport and then you have your motor.
My scooter.
What do you call it?
My scoot. But I'm kind of not supposed to ride the scooter anymore. She's a little bit unsafe and at this point pregnant.
Yeah.
It's probably not a good idea. But yeah, we're actually in the process of buying a car because I'm not going to put my kid on a scooter. So that's a whole terrible process here.
That is something that I didn't even think about.
People do it. You see it all the time.
Yeah.
If you think about Asia, right, you see 6 people on one scooter. But I'm just doesn't seem that safe.
Yeah.
We're going to have to back way up because I need to hear all of this.
Okay, so we're so excited to have Ali Ramos with us today to talk about pregnancy after IVF because Ali is in her 2nd trimester. Are you nearing the 3rd?
Tuesday. Tuesday is 3rd.
Oh my gosh.
Yeah.
Tuesday is 3rd. Yeah. And I'm in birth month now, or hopefully in birth month now.
Yeah.
I'll be very, very upset if June is not birth month. But yeah. And you're in Costa Rica.
Yeah.
You have such an incredible story. So I'll give you the floor.
Okay. My name is Ali. Katie and I guess know each other from high school a little bit and then reconnected thanks to social media, actually. Sometimes there's good things about social media. I am pregnant after IVF and I am a nutritional therapist. So I work with women going through things like infertility, autoimmune issues, PCOS, endometriosis. That's generally a niche of people. I talk a lot about periods, but I also just find joy in making content and satire and sarcastic things. And yeah, I live on the South Caribbean side of Costa Rica, but I am a Northern California native. So I think that's my intro.
That's amazing. Before we get really into it, I have to know what brought you to Costa Rica.
I get asked this a lot, and I wish it was this glamorous story. Similarly, I guess kind of what Katie and your husband did. We traveled for a year between 2017 and 2018 with a big chunk, 6 months being Southeast Asia, 6 months South America. We did not come to Costa Rica on that trip, actually. And our entire plan was we got back, we got our jobs back, actually better jobs. And we were a year or two into it, we're what are we doing? What is this for? Back in the rat race. It was the time where everyone's life had kind of changed and we had left. And I think it was kind of that pivotal moment where people are either married and having kids or on their 2nd kid. And here Chris and I are coming back from backpacking for a year. So we went back to Sacramento And we were like, where do we want to go? Our original plan was Asia, Cambodia specifically. And then COVID happened and that plan got ruined. And we came to Costa Rica. My husband had been here in like 2008 or 9. So it was so different. And we came here on vacation and we were like, could we live here for like 5 years? And we're like, sure, let's do it. And that's really how we ended up here. And now we're on almost year 4.
Wow.
So
That's
it's
awesome.
like, it's not
I
like
think you'll make it
a
5
tie.
years.
I think, yeah. Definitely with, we aren't having our baby here, but the whole process of like a newborn and like, yeah, definitely we'll hit 5, if not probably 6 years. I joke because I'm like, yeah, no, his brother's in the freezer. So like, we can't just leave Costa Rica. Like, we're going to leave him here. Like, I'm like, me and my little pink ice chest on the airplane. I don't think that would work. So yeah, probably after that. I don't know. I'm not sure what we'll do, but
right.
yeah.
Amazing.
That is so funny. I know. I think about that a lot. Amy's like godmother to our embryo because he's like really close to Amy's house, and we keep moving farther and farther away. And I'm like, he's in the freezer and just in Amy's neighborhood. So
I go check on him.
Yeah,
from time to time.
Wave at him.
Make sure he's okay.
Yeah. Yep. Oh, you're okay.
Ali, do you want to share with listeners what was the decision to do IVF in Costa Rica versus coming back to California and doing it here?
Well, we didn't know we had to do it when we moved here. So there was that part.
Okay.
And then finding out we had to do it. So like, I guess I'll backtrack. Yeah. Okay. So we didn't know we had to do it. I do have stage 4 endo, which we didn't know how much that was going to play into the IVF process. But I would say our plan was to like start trying to quote unquote get pregnant in June of 22. We were like, all right, like if it happens, like my husband was the best man in a wedding. So we're like, that wouldn't be a good time. Like when you're back in that, we're like, let's like schedule this out. Cute. And then
when you think you can schedule anything.
Yeah. And like, so in June, and then I think like September had come around. And I mean, being what I do for a living, I was like, something is not right. Like after coming off of all of the hormones that I had been put on for endo, like I had a very regular period. Like it was pretty well managed with my lifestyle and no hormone therapies. So I was like, something is not right. Like what is happening? And the cool thing about being in Costa Rica is that like, you can just do whatever you want as long as you pay for it. Right. So I was like, let's just like have a sperm test done. Like, let's just like make sure. And we did, and it came back like 0. Like, I was like, what? Like, how is that possible? The next thing they did was test all of my husband's hormones, which came back normal. And we were like, what is going on? And they were like, you need to go see a specialist. So we do go see the specialist. They call in a urologist, and he was like, well, for whatever reason, you don't have a vas deferens. Like, it's just like, they could just like feel that it was not there. And he was like, this is probably why your hormone levels are fine, but your sperm is 0. And we were like, what? Like, what does that even mean? Like, how does that even happen? And he was like, it's just kind of like a congenital like defect, basically. And the very like next month is when I started to get really sick. And I didn't know at the time, like, if this was like a horrific endo flare. Like, I didn't really know what was going on. Then I had a seizure. And again, like, I've had seizures before, but no one could really figure out what was going on with me. And I went back to California to a functional medicine doctor. And we kind of slowly over that year pieced together, like, I would wake up covered in rashes. I had like full joint pain. So they started to rule out, like, is this another autoimmune disease? Because endo loves to go well with other autoimmune issues. Then there was like the seizure, and my older sister has non-remitting, non-reoccurring MS. And they were like, maybe it's early signs of MS, maybe it's RA, maybe it's lupus. Like, actually, lupus makes sense. So then I was like, under this umbrella, they were treating me for lupus. And then I lost function in my right hand. So nobody could figure out what was wrong with me. I go back to California and I was like, could this be mold? Like, could this be mold? It fits. And like, at this point I'm in school, right, to become a practitioner. So I was like, I've heard other people's stories, and mold generally gets like really downplayed. And we slowly pieced together that that was what it was. So I had to start something called peptide therapy injections. Which basically go in at like a cellular level, and they push whatever the co-infection is. So like for me, it was mold out, but you generally get like worse before you get better. And there was no way I could have started the fertility treatments like while I was doing those things. So this like really did push us back a whole year, and they couldn't even guarantee that that was going to work. So we were hoping that it was going to be a year. And one of the things that our clinic talked to us about was that I probably was not a good candidate for an IUI because, again, something they had never told me about. I've had so many surgeries for endo that Like at this point, they were like, if you're going to have an issue, it's going to be with implantation because of the scar tissue. So they were like, I wouldn't even waste your time and money, especially because of the process it's going to take for Chris, right? Because it wasn't just like a normal semen retrieval, right? Like he had to have a surgery each time that we did a like egg collection as well. And so it was like this whole process. And so we had decided we won't even try with an IUI. Like, why? So then, yeah, like I started to get better. The peptides worked and I started fertility treatments. But yeah, our first cycle, I actually had a complication with the egg retrieval. I don't know if you remember me talking to you about that, Katie. Like, it wasn't ovarian hyperstimulation syndrome. It was, I don't know what the medical term is, but where they go in, they do your egg retrieval and your ovary doesn't like patch back over. So my ovary was like leaking fluid. And apparently it happens like 1 in 10 times, but I didn't know that this was a possibility. So it was extremely painful. I looked like 4 or 5 months pregnant at the time, and there's not much they can do unless it's like you're bleeding a ton, which I wasn't. But yeah, that was not a great experience. Our first cycle didn't result in any genetically normal embryos. My husband does have the Mediterranean fever variant, which is important to know if you have, because if I had that, that would have been bad. And he also has a cystic fibrosis gene mutation, which if both parents have, you can not only pass on actual cystic fibrosis, but you can continue to pass on the gene mutation. In men, this causes male factor infertility because while they can produce sperm and they have the hormones, it literally can't upset their body. So it is considered male factor infertility, but if you can have a TESA procedure done, then like, there's a way around that.
So that's also what your husband has, right?
Yeah.
Yeah.
Yep. We thought that he had that. He has a cousin that has it as well. But it was just kind of like, I don't know if I didn't agree with this because I went ahead and did the testing anyways. Like I said, you can do whatever you want in Costa Rica if you pay for it. The fertility doctor was like, well, why does that matter? Like my job is to create a healthy embryo. And I was like, right, but you can have a healthy embryo with genetic abnormalities. And if I was just going through these cycles and like getting the same results, I'm not only wasting money, but like emotional like distress going through that entire process and then grieving it and like trying to start back over. Like I didn't expect to be so distraught and so sad about the loss of all the embryos, but like it is really hard to grieve that, right? You're just like, I thought that this was going to work and it didn't work. And now we're literally back to square one, which I'm sure, you can relate to.
Well, and not to mention too, all of the hormones that you are going through in your body, having stage 4 endo also will impact your endo, could make your symptoms worse. Like there's much more on top of just like, are we making an embryo? Can I do a transfer cycle? Like it's interesting to hear you say like the doctor's instinct was not like the holistic view of the whole picture. It was just like, my job is to, 1 egg, 1 sperm equals an embryo. That's my job.
Yeah.
But there's just like so many more consequences.
Yeah.
Going through.
I think that goes into the whole like subcategory of going through IVF in another country, a religious country, and in a country that makes a lot of laws based around what I would call like old practices and religion. So like even doing PGT-A testing is not standard here. Like we had to send.
Yeah, didn't you have to send them back? Yeah.
Yeah.
Yeah, I remember
that.
You
had to send the embryos back to the US?
The first round they did, what is the, oh my God, not PGT-A, but where they test the medium. It's a different, is that PGT?
It's a different letter.
Yeah.
Like M? Is it PGT-M? Yeah.
Something. I think so.
I think it's PGT-M.
They did that the first time, which still resulted in us finding out they weren't viable, right? But I at that point felt like I had already gotten my certification in IVF language and I pushed and I was like, no, like I want to do PGT-A. And I actually did make a joke video about how my embryos biopsies were lost because they had sent them to a lab in Florida and something had happened to other people's embryos at the lab. Not our biopsies, but somebody else's, which I was just like, oh. And so it took longer and they had to send the biopsies to California, actually. So and the other thing is, because it's not technically a legal practice here, right? That even finding out the gender of your embryos is not a legal practice. I had to be sent the results so that I could just interpret them, right? And like when you look at like your PGT-A testing results, you see like, okay, do they have all the chromosomes? And then by default, you see the gender of the embryos, right? Because you see the chromosomes. So yeah, just like there's a lot of weird, again, it's all that I knew because we didn't go through it in the US. But yeah, there was a lot of weird things that I remember asking you, Katie, about because I'm like, I'm seeing totally different things like on TikTok, like in the IVF community, like POI injections. I'm like, what's a POI injection? And they were like, no, they're not legal in Costa Rica. So I never did POI. Just like very weird things that happened. I didn't know.
Progesterone shots are not legal?
No, I did oral progesterone the whole time.
Wow.
Oh, interesting.
I wonder
Yeah.
why.
I think it actually comes down to drug manufacturing companies and like getting the right drugs, because I will say on the flip side and positive side, I was doing significantly less hormone injections than what I would hear other people going through, because I was using, my doctor is Spanish, so I was using a European drug protocol and European drugs. So I don't, like it worked. Obviously, we're here now, but yeah, there was a lot of different things that you kind of like during the process are really anxious about, right? You're like, wait, this person's not doing it, and like they're not doing this, and like in the States they're doing this and I'm not doing that. Like, is this gonna work? But I mean, obviously it did.
Wait, okay, so you're navigating all of this in Spanish, but not only in Spanish, but your doctor is Spanish, not.
Yeah. He was pretty.
So it's like,
how is your Spanish? European Spanish or
Central American Spanish? I don't speak Catalan, like,
because they're very different.
Yeah, very different.
Yeah, they are.
I can get by. Like when I was in Barcelona, I was fine with my Spanish, but my Spanish is actually from Colombia. So even here sometimes I'm like, that's not the right word. Like that's actually different. He did speak, like my nurse spoke English. So like, thank God. Right. And majority of I don't know if this was your experience, but you're talking with the nurse. You're not really talking with the doctor most of the time. But he did speak English. I think that sometimes, and I caught myself doing this at times too, you agree to something when you actually don't understand it, or you think you understand it. And so it would have been better if he flipped to Spanish, because I think my understanding of his Spanish was better at times than his understanding of my English. And there's also the fact that I'm a practitioner, right? So like, I want to know why I'm doing certain things. And to your point, Amy, like I did have a lot of problems with the estrogen, right? Like my first cycle, we didn't use suppressive birth control. And I have a really hard time with birth control, which is ironic knowing what I know now because of all the years of endo treatments. But yeah, I wasn't responding well. It was really hard. I had a lot of side effects from it. And it was just like, well, it's kind of what you do. Like, kind of like suck it up. Like, good luck. And
it's sort of part of the process, right?
Yeah, I'll be honest, I don't know what postpartum is going to look like, but it does make me a bit nervous because my endo has been in such a good spot, and it was not for like majority of my 20s. And so, yeah, I'm a little bit nervous to see what happens postpartum. Especially I think part of second trimester that I didn't anticipate having issues with was the progesterone. Right? Because for me, I was on these oral tablets till week 13, and I had a really hard time with like horrific migraines, like just things that you only find out when you're like in. So yeah, I'm like hoping it's not terrible, but we'll see. We'll see how postpartum goes.
Well, you mean in the second trimester with the progesterone kicking in naturally now? Your body,
no,
your body's kicked in on its own.
Sorry, I worded that weird. Like, so up to week 13, right, I'm on the progesterone. And in my mind, I'm like, well, it's oral. Right. So, like, these headaches should go away because I'm not taking it anymore. I think I was a bit naive. I think it takes a lot longer to come out of your system than you just stopped taking progesterone. And they did, like, I tapered off of the progesterone. With the estrogen, I just, like, stopped. And that was, like, a really abrupt, like, first trimester with the estrogen was like, whoa. But yeah, I think it took longer than I thought it was going to get rid of the symptoms.
And it's also interesting what you mentioned about like the protocols are so different. That's not something I've really thought of and makes me really want to ask questions about now. Like I have heard that we do a lot of, like there's a lot of meds involved for a lot of people. Like our general cycles are highly medicated, and then if you have like diminished ovarian reserve, you maybe want to do something that's like far fewer hormones, right? But that's not the typical path. So yeah, you've given me something else to go dig into. Question.
Oh no. Yeah,
I know, right?
I don't know, and like again, I didn't get a lot of these questions answered. I don't know if, of course, I do think endo had a component of the egg quality, right? Not quantity, because I think my first retrieval, we got 9 follicles. There were 13, but he was like, I don't like those other ones. And I did take a big break. Like,
Why?
I don't know. He was like, no, I'm leaving those ones. I was like, whatever.
Maybe too small or something?
Yeah, I think they were too small. I did take a break between the first and second, and I know a lot of people like to like jump right back into it. And I think my mentality was a more holistic approach to it. And I was like, no, like there has to be more that I can do than like he was like, oh, this is kind of like what happens sometimes. And I was like, I refuse to accept that answer. Like, absolutely not. And so, yeah, I mean, I got really deep into like, how can I support the quality of my eggs? Because I think endo does play a role in that. And also at the same time, I was like, Chris, what can you do? Because it actually takes longer to improve sperm quality than it does egg quality. So I like really put like my own like practitioner hat on, and I dug into like appropriate things that we could be doing. We got really into weightlifting. I also have a thyroid problem from all of the years of hormone therapy. So I was like, what can I do to help that? And I was able to, I don't know if this was luck or everything we did. I like to think it's everything we did, but I did double my egg retrieval count by the second one. So again, I don't know if it was everything we did, but I would like to believe that, because whether it was us, I think, working on it together, right? Like sperm does also play a role, like all of the things that go into the sperm play a role. But yeah, I don't know if my protocol was based on the sense that he did change. I know he changed things from the first and the second. And he did require me to go on a suppressive birth control. And again, that did not help my endo. But yeah, compared to, I had two people. So Katie, you were like a little bit ahead of me. And then like my best friend's other best friend was going through a similar round of IVF, like to the reasons that we were. And so I would listen, both in California, right? So I would listen to like what you guys were doing, and I would see you talk about on your Instagram, like what was happening. And I was like, oh, I'm not doing that. Like, I don't like, or when your guys' podcast would make like the jokes of, how do you say it? Monopure? How do you say that drug? I'm like, I don't even know what that is. Yeah. I was like, I don't know what that is. Like it was just like so different.
Good for you.
But yeah, I was like, based on these memes, I'm going to go with this is a good thing.
It burns.
That's what I think.
I'm sure you had your own experience.
Yeah. I was a control freak, and I did all my own injections. I was like, no, Chris, you're off. You're out. And then the one time I had to do the really big trigger ones, I would go to the pharmacy and I would have the pharmacist do them for me, because I was like, do you think you can do an intermuscular injection? And he was like, no. It's like, good, because if you mess up, it's going to hurt really bad.
I think this is really good to point out, though, because I've never really thought about the fact that doing IVF in a different country, you're probably going, like, you're dealing with different drugs and different regulations. And I think a lot of people just think, oh, I'm going to go to Europe to do IVF, or I'm going to go to Mexico to do IVF because it's so much more affordable, or, you know, they hear all of these things. And, but like, yeah, I guess I would not have like thought that through or prepared myself for, hey, like there are different legalities, there are different like pharmaceutical
so much
drugs
different.
And
yeah,
so interesting.
I would say,
and that's not necessarily, I mean, it's not a bad thing. It's just a different protocol, and like you have to kind of adjust your expectations that what you're seeing on social media or from people doing IVF in the US, it's going to be very different.
It's 100% adjusting your expectations. And for an already anxious person, it was creating a lot of anxiety, because you want to not compare yourself or compare like even why you're doing IVF, right? Like, I think what I have learned so much, and also having like viral videos get bad comments, is that people are doing it for so many different reasons, right? Like so many different reasons. And I think the one thing too is just to be very mindful of that, right? Like my protocol also could have looked different because of that, right? Like because we knew what we were looking at. But I do think I would say something when I was ending, right? So I was getting ready to graduate. There was this whole influx of Americans that were coming to Costa Rica because it's just just ridiculously expensive, and I get it. And I will say, like, while we didn't know that we had to do it when we moved here, like blessing in disguise, because it's probably 1/5 of the cost.
Wow.
I will say where I live specifically added an entire expense sheet to that, because I mean, in August, I went to and from the city 4 times, right? Like And that's not an easy process, which also meant a whole level of navigating IVF without Chris, because our house is here, we run a zoo. Like both of us being gone at the same time is a lot. And so, yeah, I would go by myself, and then I would come back and I would try to explain things I just like also didn't really understand, but then also in a second language. And like also you have to have like your whole separate like IVF language. Like I feel like there's a whole language of it. Like I remember for the first time seeing things and being like, what does that mean? And now full circle, I'm like, oh, I get it now. But I think, yeah, there's a huge influx of Americans coming to Costa Rica. There was 8 couples that were starting in January from like Texas to California. I have heard amazing things. I won't lie. I have heard amazing things about Mexico City as far as medical tourism. But there's so many caveats. There's so many caveats to doing it with all of the like added travel, language, currency, being there for a certain time. Like, whereas like some people get to drive down the street to their clinic and like, or an hour to their clinic. That was just not our story.
Yeah, you also mentioned something that I wanted to double click on too about like if you kind of navigating it on your own because you couldn't both take the time off and do the commute together, and it's already a hard process for I think a lot of us to feel like we have enough support or like we're not, I don't know, that I don't want to say it in the wrong way, but like, of course our partners support us, but they just they can't always understand it, right?
No.
And sometimes when they're there and they can see it and experience it with you, like Katie, you've mentioned being like having Anthony in the room and it's like, he could see it, and then to have to translate that, not just like in time, but language and all of the other things that are on top of it. Yeah, you bring up a really good point. That must be challenging. And
I think
also,
it was.
You run a zoo?
Yeah, we have a lot of animals. We have a lot of animals too from the US.
Like not a literal zoo, but like.
Okay. Yeah, you forgot to mention in your bio, Ali. Ali in a previous life was a vet tech.
Yeah. So I worked in vet med for 15. I was an ICU nurse. And then I was an administrator, and then I ran like a specialty center. So all of my American animals, we call the leftovers because they were left over. Like someone couldn't pay their bill.
Yeah.
Yeah, like all of them. And then we have the Ticos that are like we call them Gen 2, which are just a whole different breed of animal. Like my American animals travel, like they've lived in 3 countries. My cat, Ducky, when I go back to the US to give birth, she's coming with me. So like, it's just like a whole dynamic. But yes, one thing I want to point out to your point, I think that the IVF process for me, and I think there's probably a lot of people that feel this way, really triggered a lot of my medical trauma from the years of endo. And I don't know if that was like me specifically because of the doctor relationship, but this actually just got brought up in a therapy session this week because for the first time in my entire like experience, besides my last OB before I moved, I feel like I have a team, and I specifically chose like the birthing center that we're using in Sacramento and the midwife team. And it finally feels like, hey, this person respects what I do. They listen to me. They know what I want. They respect that I ask questions. Like they're okay with it. That's not a weird thing. And for all of the years that I had endo and was like, there's not much you can do, or just being like dismissed with the pain level, or like, well, here's another surgery. Yeah, I think the IVF process is really, really, really triggering, not just physically, but like mentally. And I was one of those people that was told early on, like, hey, you may need to do IVF for your endo. Full circle, ironic that it wasn't really because of my endo that we did it, but it was one of those things I think early on that I was like, I'll just never go through it then. I just won't have kids because like I'm not doing that. And then obviously you say that till you're put into the situation and you're like, okay, I'm going to do it. But it was, and I think it probably will always be a time that feels very lonely. Brings up a lot of feelings that you're like, I've been here before. I don't feel like you're listening. When all of the things that kind of happened around the egg retrieval or complications with estrogen or like birth control came up, it was like the same, like, oh, there's not much we can do. Like, and I was just like, I hate being here. I hate this.
But somehow you found a way to advocate for yourself, it sounds like, both in the the testing of the embryos, the testing of your genetic testing with you and your husband, Do you think that the experience of all of that time and pain going through endo prior to IVF set you up to kind of understand when to push back, or like know that you needed to push back?
Yeah. I think it was like a mix of things of not pushing enough during the first cycle, right? Like not asking the questions that I would come home and be like, wait, I don't know why this is happening. Or like, why am I doing this? Why aren't we doing that? There was a time, I don't want to say we got in a fight with that I got in a fight with the clinic, but like kind of, and considered switching clinics. And actually like looked into going to a different clinic, and then I was like, this is a nightmare. We'd have to start all the way back over. Like they were going to make us repeat like testing that was just not necessary. Like I know why we're doing IVF, and it, like we don't need to repeat some of that stuff. And so at that point I was just like, okay, if I want genetic testing done, I'm going to look up where I can find genetic testing done. And I found an OB at the time here in Costa Rica that was like, if you want this, this is where you will go to get it done. And I was like, perfect, I want that. So that's where I'm going. And I scheduled the appointment. And then the PGT-A testing, yeah, I did. I pushed back on that because I was like, I'm not doing this. Like, I do respect the people that will do just like, I guess, however many cycles it takes, to work. But I remember having this conversation with Chris, and I was like, I don't know if I can do this like more than this time. Like, and I think that sounds really crazy to a lot of people in the IVF community, because it's not that I don't want a baby, and it's not that I don't want a family, but like you also have to know when you can't do something anymore. And I will say IVF was really hard on my body during the first part up to the retrieval. Just watching your body change in a way like you're not even pregnant yet, right? Like that's already weird enough watching like what's happening, but like I think I gained like 30-ish pounds just going through the process, which is fine, right? Like that that's going to happen, but like it's hard. Like it's such a mental game. And I remember being like, I don't know if I can do this multiple times. And he was like, what do you like? No, we'll just do this till it works. And I was like, no, no. Like we're going a different route if this doesn't work. Like I can't. And like I honestly joked in the beginning. I was like, well, we'll just do another retrieval, and then we can also have like maybe girl embryos. And then I was like, absolutely not. What was I saying? Like, nope, boy, mom, that's it. Like, I'm not doing this again. Or he's an only child. I don't know. But I do think, yeah, I think to be honest, it was community. I think it was talking to people that had, whether it be on TikTok or like talking to you, Katie, was so profound in so many ways. Like I would go and talk to you about certain things, and then I would go and talk to Chris, and I'd be like, no, but I talked just like talking through it with somebody that actually knew what I was talking about was probably the most helpful thing. And I think it was like that gave me enough to be like, no, you know better. Like you've been here, you can go push back. And yeah, that's what we did.
I think that is probably the thing that surprised me most, is that IVF is so, so hard on your body, and everybody experiences it differently. But I also had a really hard time with, and Amy as well, with the hormones specifically and how they impacted just mental health, but also like physical health and just like not feeling like yourself. And I always anticipated that once I got pregnant, that it was going to be like I don't like, it's such a naive thing, right? To think like, oh, like my hormones are going to level out. Like I will feel so much better pregnant than I did going through IVF treatments. And I think this is something that is really fascinating to me, and something that I've been thinking about a lot in the last few months, is how, especially for people who did really whatever they needed to do in order to get pregnant, there might be like a feeling that you can't complain, or you can't really share like what comes with pregnancy, and how it's not necessarily fun for everyone. And there are people that like I'm over it. Like that's what
Fair.
I'll say is I'm
fair.
I'm done. I pulled up, and then going back to like what you were saying about community and just needing to hear from other people who are either in the same situation as you or a little bit ahead of you. I pulled up, I haven't even revisited them until today, all of my Reddit posts from the first couple of weeks after transfer. I know, they're terrifying. And one of the things was about sleep during the 2-week wait after frozen embryo transfer, because for me, sleep has been probably the hardest thing about all of this. So I'm just going to read it. I said, we had our first frozen embryo transfer on October 7th, modified transfer with prednisone, progesterone suppositories, and baby aspirin. The night sweats, vivid dreams, and restless leg syndrome have been unbearable since 5 days past transfer. Planning to reach out to my clinic to see if there's anything I can safely take to help with sleeping, but I'm curious if anyone else has had pregnancy safe tips or tricks for this. We had a positive home pregnancy test, so I can push through if needed, but the anxiety is bad enough and I'd love to get good sleep before beta if possible. That was 230 days ago. And this morning I was texting Amy and I was like, yeah, slept like shit again last night. like it literally started as soon as we transferred.
Same.
And I just, yeah. So anyway, just throwing that out there that I feel
Reddit.
like,
Oh, Reddit.
I don't know what it, like, I guess what is the question that I want to ask here? Because it's like, I don't even know if I have a question. I just want to like throw it out that like pregnancy can suck and like, that's okay.
Yeah. There's so many things
after
that you
IVF
said
and fertility treatments
in there that I'm just like, oh yeah, that. Like, first of all, the Reddit thing alone, right? Like, you're just like, I think really what it is, and like what Reddit is like there's so much anxiety in the whole process, right? People in the infertility space, whether they're doing IVF or reoccurring miscarriages or whatever, I swear they're like standing on their heads. They're doing vibration plates. They've done parasite cleanses, like every red light thing, right? Like we're so worried, right? Like, are you eating the right foods? Could this change that, right? That like the idea of just like we're not doing that enough, or like manifestation, like, are you kidding me? Are you kidding me? And I also work with clients, right, that have things like PCOS, which is very common that they will deal with infertility issues, right? So like I see it, I've lived it, and really what that strikes is this anxiety factor and this thing that we just aren't doing something right, or that we're not healthy enough. I think even after my embryo transfer, that didn't go away for me. So I was also on Reddit, and my husband's on Reddit. I had convinced myself I was getting my period, because you really cannot tell the difference between the transfer worked and you're getting your period. Like, that is so true. I've heard people say that, but like I had convinced myself that and like then I was really sad because it didn't work. So I took a pregnancy test because I just had this one pregnancy test. It was I did it wrong first of all, and then it was positive, and I was like, what? Like this can't, what? And then I had bleeding. Like I had a lot of a significant amount, probably like 2 weeks after that, which was like past the point of when it was past when implantation bleeding should have happened, right? So now I'm on Reddit again, and my husband's on Reddit, and I'm like sending pictures of like my blood to the fertility clinic. Nothing normal. I'm like, God, nobody go through my like pictures, please. And like Chris is like, no, it says on Reddit, like if it's dark, do you think it's dark? Like, let me, I was like, oh my God, like the stuff that like I just like never wanted to have conversations about with my husband, but like whatever. So yeah, I think that level of anxiety, I think I would have expected to go, probably go away by now, right? But like be better by now. And like I don't sleep. I've always had insomnia, but I managed it with edibles, and obviously I can't do that when I'm pregnant. And so yeah, I got to the point where what can you do, right? And then it was the doxylamine or like Unisum. But then you get in your head, it's like, well, what are the long-term effects of this? Do we even know the long-term effects? Like, am I hurting this baby that like I put all this stuff into trying to get to? Or have I drank too much caffeine? Yeah, I definitely drank too much caffeine today. Great. Like now I'm going to look at low birth weight. Like it just, the spiral never stops really. And I think to all of everything you said, that's what that brings up for me is I have not felt like centered or like a normal person in so long, that you're like, I just need this to be over so I can see that my baby is like okay, right? That like it's gonna be okay. And I don't know if, and then someone's like, oh, that doesn't go away even when they get here. And I was like, no, don't tell me that. Like, please just let me just believe that when he's born it's gonna be fine.
Yes. First of all, I love that you're like a Reddit family. Like yeah. That you both like have your own like search histories and accounts. Yeah, I think that's such an interesting point about the anxiety not going away. I feel like in third trimester it has gotten a lot better for me because she's very, very active, which I know that this is just like me. Like I don't think this is actually the case, but I like to tell myself that she knows that I'm anxious, and so that she's like constantly moving to reassure me. But I, a couple nights ago, took a sleeping pill prescribed by my doctor, but it's in the like not safe for pregnancy, but also not safe. So it's one of those things where like the only, I can't remember what the drug name is, but the only study that they've done on it is on rats that are in their first trimester, and they've seen like fetal harm. And so they don't recommend it for pregnancy. But then I got really confused because I'm like, my doctor prescribed this and said, hey, if you need this to help you sleep, you should take it. So I'm only taking it one other time. But the other night it was like 1 a.m. and I was like, this is crazy. Like, I'm taking this. Like, I cannot sleep. And that was 48 hours ago. And I'm still feeling the side effects of like the drowsiness from it, because it's just like NyQuil type of experience. But the anxiety that comes with that, of like, even though I'm 30, almost 37 weeks, and just like feeling that anxiety again of like, did I do something wrong? Like, is this going to be okay? Like, starting to spiral. Like, I even remember taking the drug in my bedroom and being like, you're like, you shouldn't be doing this. Like, this is bad. Like, something bad is going to happen. And then obviously, like, I get great sleep and like, she's fine. She's kicking like normal, like whatever, but it doesn't go away. Like, it remains regardless. And I think, yeah, I mean, that's something that I probably would have told myself, like, of course it's going to stay this way, but you don't really anticipate it. I feel like you think like once you get pregnant that it's like, okay, we reached the end, but then
yeah, I think
didn't.
It also brings its own, I mean, even with the drug, so like doxylamine, right, which is a technically in the class of an antihistamine. So it has been quote unquote studied because they use it for like morning sickness, right? But for me now, I feel bad because I can't sleep without it. Like, I can't sleep at all. And then my doctor or my midwife was like, yeah, but no sleep is just as bad. Like, she's like, are you worried about it being habit forming? And I was like, no, I'm worried about it like with what you don't know. Like, I'm like, what about in 10 years when something comes out and you don't know because you didn't know it now? And she was kind of like, whoa, girl. And I was just like, yeah, but like, this is where your brain goes when it took so long to get to this point. Like, the idea of really what it comes down to, the idea of possibly hurting your baby when you're trying to take care of yourself because you're the vessel that it lives in. And it wasn't just like the easy, you made love and got pregnant, right? Like, it took so long to get here. That is like the overwhelming anxiety feeling that you're talking about, that like would never, or at least for me, I'm like, I would never want. Or to your point about pregnancy not always being enjoyable, I don't know if it's because I'm older, right? Like, I'm going to be 36 almost in October, or if it's just the way pregnancy crumbled for me. But like, I didn't have your typical pregnancy. Like, I didn't get morning sickness. I got like your smelled versions. Like, I was like, that's disgusting, can't be near that. But I've had all these other really weird, like the migraines were terrible, the insomnia. I now have carpal tunnel in my right hand. Like, nobody told me about that. Like, what does that have to do with having a baby? Like, no, that's not fun. I would just like my hand to work in the morning when I wake up. So yeah, all in all, I will say sometimes I think when I look at like my TikTok community specifically, I see these people that are like in the thick of fertility treatments in like a spot that, like, if I think back, like, I wasn't there that long ago. Like, literally a year ago, I was grieving all of my embryo loss, right? And there isn't a day that goes by that I don't think about that. And I think sometimes it looks like, oh, she's made it to the other side, like she's pregnant. And I'm like, I think about it and I watch these people's stories all the time. Like, one of the girls that I follow on TikTok, I don't know what it's called, something ovum, bladum, where like there's the gestational sac, but like it didn't result in I don't know what it's called.
The blighted ovum.
Yeah.
Yeah.
I like, my heart breaks because I'm just like, no, that shouldn't have happened. Like, that shouldn't have happened to her. So I think overall, I do sometimes, I don't feel guilty for being here, but there's just like this part of me that like still feels really, really sad that like IVF isn't guaranteed, like going through this, even with when you have like a quote unquote better outcome, like we were told, like, well, it didn't work the first time and it resulted in a lot of pain. Like, I just like, my heart really, really hurts and breaks. And that's why I feel this need to like stick up for the infertility community and watch other people's stories, because there's so many, like I said before, there's so many situations and so many reasons people are walking this path. And it unfortunately was part of ours. Like, it was part of our story.
Do you feel like, I think, and I've expressed this to Amy, especially like in the beginning of pregnancy, and I think this is more of like a me personality thing more than anything else, but like I'm like really struggling to let go of that version of my life, just because it's so much of my identity, right? It's so much of why I'm here now, and it's something that I went through, right, to get to this point. And Anthony the other night, he turned to me and he was like, is it bad that I don't really think about it anymore? Like, I don't think about going through infertility and IVF. Like I've kind of forgotten, because like I think that's the other thing, is pregnancy can feel just like all consuming. Like I've never felt so in touch with my body than I do during pregnancy, and not in a good way necessarily, but just because it's like this awareness that you can't escape, right? Where with infertility, I felt like I was numb most of the time. Like it was very like in my head, in my emotions, just kind of like injecting myself, going to appointments, like checking out because of how difficult it was. Where with pregnancy, it's like everything emotionally and mentally is like a blur. And I'm just like, the days are hazy and everything hurts and everything is like so physical. And so it was really interesting to hear him say that phrase of like, I'm forgetting. Like it's becoming one of those things where it's like it happened to us, but it's no longer happening to us, where like I've been really resistant to that feeling. So I'm curious to hear like what your thoughts are, or how that experience has been for you moving into pregnancy.
Yeah, I think it brings up, I had someone that I knew that is about to start IVF. And I think there's so many things about IVF that like test your relationships, not just your romantic, but like everyone around you, right? And like none of my closest friends and family knew anything about fertility treatments, right? Like at all. Even though I think I pride myself on like explaining it pretty well. Like how'd we get here? Like I think I explained it pretty well. But one of the things I said was, you have to be like on each other's team, right? Because it can be really easy to be in the thick of it, be injecting yourself with synthetic hormones, not feel like yourself. Like there was a part where I was like, this anxiety is so bad, I want to take my skin off. Like I've never felt an anxiety like that before. And not be like, we're in this because of you, right? Like, or we're here because of you. And there was a part of me that like, I really had to get my head in the right space, which is why I said I took that break between the 2 cycles. And I remember listening to Chris have this conversation, because we both work from home, and he's having this conversation, I don't know, with someone, I don't know who, a worker or something. And he's like, yeah, no, like it's hard. Like IVF it's shitty. Like it's hard, but like, I wouldn't change that it's a part of our story. And I was like what? I would. Like, what? That's easy for you to say. Like, what?
Yeah.
And then I like, I thought about it, like, every time I would hear him talk about it. And it kind of reminded me of like my own journey with endo, right? Because I used to let endo like consume me. Like I was an endo warrior. I would write for publications about my endo. Like there was nothing you could do about it. And then one day I was like, I'm done. I'm not going to be an endo warrior. And that really triggered a lot of people in the endo community. They were like, what do you mean? And I was like, this isn't my identity anymore. This is a thing I have, and it's not going to consume me. And when I really started to get into, I use the word holistic, but not in like holistic medicine, but like the whole view of how people end up with chronic problems, autoimmune issues, like the whole body experience to it, is when things shifted for me. And I was on 9 medication for endo when I was in like a really like probably 2019. And when I was like, I'm done, I found the right therapist, and we really worked on like, why do I think I have endo in the first place? Because I could have gone with the whole, stayed in that identity, been in the space of, well, it's retrograde menstruation, or whatever doctor tells you whatever they want to tell you about endo. They all have different theories. Or I could have been like, hey, my immune system, my nervous system was all set up by my childhood to develop something. And which is why I have multiple problems. But when I stopped, for whatever reason, like got a lot less. And then I think when I heard Chris talking about that in regards to IVF, that triggered me for like a minute. And then I was like, wait, I get to be a part of the IVF community. And that most people are like, we don't want to be here. Nobody wants to be in the IVF community. And I don't, but thank God it exists. Like, thank God it was an option for us. And I do think it was really hard, but in a way, like, I am so fortunate for the partner that I have. And I think he would probably say the same about me. And I don't think that everybody's relationship can withstand IVF. I think that it could really destroy you, individually and together. And so when I think of like letting go of what you're talking about, I'm like, it is part of our story. If I want to have another kid, I'm going to have to go not through the entire process again, but definitely the transfer process. The way that I look at it is like, at least I am fortunate to have this person that is on my team that was with me in the really shitty parts of this and is still going to be with me. And I think he looks at it as like he has a partner that, you know, like did do this with him, right? Like he had no idea he was born with this mutation, like at all. Like you really don't know you have it until you're like in the infertility space. And so I don't know, I think that mindset and changing that and all the work I did with endo is probably what helped a little bit, like a little bit. And then trying to focus on the really cool people that I did meet in the IVF community. People will go to bat for each other that don't even know each other, but like they're going to go to bat for you.
So you spoke about kind of giving up the endo warrior.
Yeah, I made a lot of people mad when I said that.
To like open yourself up to like what was next. And maybe it sounds like maybe there was like an alternative way to look at and treat your symptoms and help you live through life in such a way that like hopefully moved you into a better space than just like, you know, the chronic having to just survive with this like chronic awful thing. So I'm curious, like taking that experience, has that changed the way you've thought about the infertility? Like I think IVF warrior is a thing, right? Infertility warrior is also a thing. And I'm curious how it's sort of changed the way you've approached the infertility story, because hearing you talk about it feels like you've sort of healed through a lot of this mentally, like emotionally, to like see it and value like its place in your story, but it's not defining your story. It's just a part of it. So it still has power, but maybe it doesn't have power over everything. So I'm just curious, how has that sort of shifted in your mentality?
I think that partially my approach even to endo, right? Like, so I have a medical background, right? Like that is what my first whole thing is for a long time. So A plus B is C. If you have this, you treat it with this. Like that is just, I was very black and white. And with my endo, I had gotten to the point where nothing was working anymore. Like I had done everything. You name it, I had done it. I had done chemical menopause. It wasn't working. I had had 5 surgeries. Like there was no other options for me. And I will name drop my doctor in Sacramento because he was amazing. His name's Dr. Michael Crennan. He's out of UC Davis. So if there's any listeners that are in Northern California that at least want to be, he's conventional in his approach, but was just like willing to listen. So I was supposed to be set up to go to a pain clinic. And in order to get into a pain clinic, you have to do a psychiatric like evaluation. I was like, whatever, like fine, I'll go back to therapy. And I got paired. I'm not religious, but I am spiritual. So I do think this person got put into my realm for a reason and really started to make me question everything that I ever knew, which was like a real rock bottom, but also what I really needed to shake me up. And he practices something called psychoneuroimmunology. So basically it's the connection between your endocrine system, your nervous system, and your immune system. And I remember walking in and being like, yes, I'm here because I have to go to a pain clinic. And like the last doctor I had before the one I have now basically said, like, you know, when you have chronic illness, the pain's in your head. And this therapist looked at me and he was like, well, the pain is in your head. And I was like, what? Like, why am I here? Right? Because that was like really triggering. And he was like, I don't mean your disease is not real and that everything you're talking about is not real. What I'm saying is that your body has stored this. And it took me like a whole 2 years to understand. And he would like slowly trickle things. And then I got into like, you know, researching because I needed data. Like I was like, you're not going to like, this isn't going to make sense to me unless I see like PubMed articles. Okay. And he would give me like actual PubMed articles about like childhood trauma and how it really does change your body's chemistry to set you up for chronic problems. And then when the warrior conversation got brought up, I was like, I get it. And I do understand the fight, right? Like in the endo space, you are called endo warriors and you are fighting the good fight and like you're doing all of these things. But I didn't realize that that was actually keeping me sick because I was constantly fighting against myself. And I was also making decisions to stay sick. So it wasn't like I had control about how I landed there, but I did have control about being there. And I really started to look at like, what was I doing? Like, what role was I playing in my own suffering? Like my job was one of them. I talk about like leaving vet med being one of the hardest things I've ever done. And it still to this day is one of the hardest things. I love medicine. I loved my job. I was good at it, but it was not good for me. And the reason it wasn't is a lot of people will notice like a codependency in medicine. And I didn't even know like what that meant. So the warrior was like feeding into this like codependency. And when I realized and connected those things, I was like, maybe I don't have to fight myself. Like maybe my body's been at war with itself for so long that I just need to chill, like chill. And I walked in the very next year to my doctor after doing this, and he was like, you don't even look like the same person. Like, what have you done? And I was like, I went to trauma therapy. Like there isn't anything that I haven't done. And after 2020, I got all of the medications. I had like the Nexplanon, the Implanon, and I was on chemical menopause. So I was like, take it out. I'm done. It can't get worse than this. Like the pain can't get worse than this. And it started to get better. And by end of 2020, I really had no symptoms of my endo at all. And I got really into like your cycle and like tracking and like, wait, how can I actually help it versus attack it, right? Like I think with endo, it can be like these horrifically painful periods, and I just wasn't dealing with that anymore. And I think that shift is what helped me carry it into, I don't feel like I was an IVF warrior. I feel like I'm a part of the IVF community. And I feel like I am proud to be a part of that community. And I hope that just like Katie sharing her story is what pushed me through in some of like the hardest times. Like I meant when I said it in my stories the other day, like if one person comes across my old highlights one time, that's it. Like I serve my purpose. Just knowing that like you don't have to fight it, but you can be a part of the community and you can help others and move through others. And like that was kind of my goal with it.
So much of that resonates, Ali, in that like I do feel like it's very universal. Maybe, well, I can't speak for myself. It feels very universal that you feel like you've been fighting your body for so long.
Yeah.
And what does that feel like to accept? And then I love what you said about like support my body, work with it through this instead of just fighting what's happening. So I wanted to say that, like, I love the way that you frame that. And I'm sure that there are parts of pregnancy that feel like you're just like, why is this happening, right? I can't sleep. I'm fighting it. I'm just like fighting to survive and like stay sane. But also, yeah, it feels like a life lesson to just figure out how can you lean into instead of out of constantly.
Yeah, I'm trying really hard. I'm definitely not perfect with this mentality whatsoever. Like, let me put that out there, first of all. Like, I definitely have
It's a
days.
practice.
Yeah. And even with our decision, which I know we haven't talked about, but like our decision to go back to California, like I'm going first. Like Chris isn't coming for a whole other month after me. And for people that know me, that know how important my animals are, like this is a really hard choice. Like it's not going to come without consequence, but I still know it is the right choice. And we had this conversation in my therapy session. I'm still in therapy, by the way. This is 6 years later and I'm still here. So we talked about the embodiment practice of what you're talking about. Like, how do I keep carrying that through a really hard time postpartum, not knowing what's going to happen with my endo afterwards, not knowing what's going to happen with the mold, like all of this could resurface, but I don't have any control over that, like at all. So I'm trying to carry that. And I'm also like, as someone who has a lot of childhood trauma, very wildly aware of the fact that my kid already knows what's happening, right? Like that's such a wild concept that like they can hear, they're inheriting part of my super anxious nervous system that's happening right now. And so, yeah, we talked about like, how do you create that? It's not just a mindset, but the space, the embodiment practice. And I'm not traditionally good at that. Like it's taken me a long time to arrive here. So I think it is slowing down, right? Like I don't know if you feel like this, Katie, but like I do one thing and I'm like, well, that's the task for the day. Like, what's a job? I don't know. But like that's okay. Like I'm also just like trying to tell myself if I were talking to somebody else, it would be okay. Like it would be okay that like, I assembled a rocking chair and that took me out for the rest of the afternoon. And if somebody at my stage of pregnancy told me that had gone through IVF, I'd be like, cool, check, you did it. So now it's just like constantly trying to practice that again. And I mean, like I said, there's so many research articles out there. I know this sounds really woo and like spiritual, but I'm like, Gabor Mate talks about this. He did a whole actual YouTube clip specifically on endometriosis and the correlation to endo and like fibromyalgia. And when you start to hear actual doctors talking about the thing that you have that has not historically had a lot of research done on it, it's so validating. Like it's so validating in a way that it's not just this like reproductive disease, because endo is not. It is a whole body, mind, immune, has a cytokine, like inflammatory response. Like it's so validating. And so I feel like I've finally arrived at this point where it's like, I'm going to be okay with it and I'm going to do the best I can to carry it. And I'm not going to fight it. Like I'm just not going to fight anymore.
One of the things you said that really stuck out to me, and one of the things that I've been processing in these final weeks is like just like, what does it look like to let go, right? Like, what does it look like to kind of say farewell to this process, but also still be in the infertility community, still be a part of the IVF community, but like also allowing myself to transition into this new season and allowing myself to envision a future of like, what if I don't have to fight like in these next few years? Like, what if I can enter motherhood and transition out of this season, and it doesn't have to be me always like pushing and advocating and fighting, and just like really allowing myself to like let all of that go and to be on the other side of it. So I don't know if any of that makes sense, but that's just kind of like where I feel like my emotions are heading in these final weeks.
It feels like a yin and a yang, to be honest. Like I do get fired up, and I do feel like I want to protect the infertility community. Like I
Totally.
do, right? Like you see these comments like that, you're just like, how? Or our political climate, always, it doesn't matter who is elected, it always gets brought up. Like, why are we always defending it, right? Like, and that's not necessarily true for like every country, but it is definitely true in the US, which impacts, as someone that doesn't live there, I can tell you the US impact is so much bigger than the US even understands. So yeah, like there's the yin of like, no, this is really important. And you see people's stories transition, right? Like, Amy, I've been trying to like keep up with your story and watching that transition, but that still feels like a different category, right? Like I still want to defend that, right? But then at the same time, I see the other side of like, you have to be very conscious of the energy, I think, at least for myself, of how much fighting, how much I'm going to hold on to as I carry this in. Because something that, like, when I talk about the embodiment practice that I'm trying to do, my therapist is like, what does this look like? Like, can you close your eyes and can you feel it? Like, can you connect from your actual heart space to your womb, like your baby that is there, right? Like, and even for someone who doesn't have the baby there, like connecting to a womb, especially for someone who has something like endo or PCOS, is so important, and being able to do that. And I remember when he first asked me that, I was like, what are you talking about, bro? Like, I don't know what I see. Like, I don't understand the question. And now it was like, okay, I have to create that. Like, your mind has to create this neuroplasticity and this rewiring so that you can detach and there can be balance between the yin and yang, and you're not just constantly holding on to this. Because, like, also, Katie, watching your story, right? Like, you worked really hard to get here, and it's gonna be here. Like, my app scares the shit out of me. I'm like, whoa, 80 something days? Like, no, we need more time. Like, that can't be right. But now I'm just like, okay, like, no, worked really hard to get here. This is what we wanted. And it's like, you deserve it. You deserve to be here. And however any person gets there, whether it's surrogacy, adoption, choosing no, like at some point, like some people are like, I tried and it didn't work. And like, that should be honored in our community as well, I think. And then there's the some where it resulted in pregnancy, right? And now you're going to have this baby and you worked so hard to get here. And just like watching you as a person, whether that be your travel stories or your writing, like as someone who really resonates with that, I'm like, you deserve it. And honor that. Like, it's okay to like have some of it, but also you deserve to be here and you're going to be a great mother.
Well, thank you. That means a lot. Yeah, I often am having to remind myself, or I feel like the mantra that I'm like carrying into this next season is that like infertility and IVF are very much like my story and my legacy, and I'm very, like you, like proud of that. Like, I want to be part of this community, like even if it looks like more big sister energy, and being on the other side and like reminding people that there are better days ahead, whatever that might look like. But also, like, I don't want that to be my daughter's story. Like, yes, it's her origin story, but it's not her legacy, right? Like, it's not something that she needs to be reminded of, or it's not something she asked for. And so like, that's like really important to me as well, is to like transition into motherhood and not like be an IVF mom, but an IVF mom for me and for this community, not for her.
Yeah.
So
I actually have a follower who is an IVF baby, and she's like, oh, my parents, I think she's like mid-20s now. And I think that it's a really cool, it's not necessarily their legacy, but like you said, it's their origin story. And one of my really, really good friends here in Costa Rica is one of the first like reproductive technology of where she, like the country that she's from. Right. And I'm like, she's the chillest person I know. Like she's literally the coolest person I know. And I'm like, it's not like her whole story, but she's like, oh yeah, my parents did it. And she's like mid 40s. And you're like, wow, like that is really cool. Right. Like when you think about it, when you think about how long it took you to get here or what went into it, like if people knew how much love went into wanting this baby, however you get there, like I think the IVF babies know that. So while you don't want it to be her like whole legacy, I think it is really cool that, yeah, like her mom started a podcast about it. She's in this community. She is big sister energy. Like she wrote about it. Like that, you know, we don't know what technology is going to be like when she's in her 20s, but I think it is just something so cool to own and have.
I think something that comes to mind for me too, and you know, I'm not where you both are, but what I think I know is true is you can still trust yourself, right? Even though you're nervous to go into this new chapter, can you let go of enough of the trauma, still being true to yourself, but making space to kind of grow in and take the space into this new role that you're about to take on, and you've already started to take on, having been through everything you've been through. But to get here, you have to also look back and realize you did that. You both did that. So maybe, I don't know, I'd just offer that, like, something that you're doing is you're doing something right, right? Yeah. You can like kind of trust in your own strength because of where you are now. Does that make sense? Like,
yeah.
I hope that makes sense.
It makes total sense. Amy, I feel like you're so wise, because it's like, yes, if I step back, because it feels like imposter syndrome. I think that's what like some people
That's it.
don't.
Right there.
I feel like from the outside, it looks like, oh, they must have all of their shit together. Like they've worked so hard. Like they've, like we're women who like get it done. Like we have gotten to this point, but like it doesn't feel like that for me personally. It feels like that witnessing the two of you and witnessing others in this community. But yeah, you're so wise to just like remind us all of that, of like, yeah, we can trust ourselves because we've gotten ourselves this far. And I think that that's like really profound.
Yeah.
You won't know what's coming for you, right?
No, never.
Well, so there's no book. Also, when that kid turns 18 and then they bring home a partner, and then, when they have a kid, like you will never be able to know how you'll handle the next thing. But I think what you do know is that you've handled everything thus far. You've gotten here. You're still in one piece. You're both strong, happy, joyful
Lots
women.
of therapy. Lots of therapy.
Lots of therapy, lots of support, lots of community support, lots of other women giving you big sister energy, right? And I love how you said that too, Katie. Like, I do think that's something very special about the IVF community, is that you sort of maybe graduate to a different role in it, but you're never out of it, or you don't have to be out of it, right? And you can still like give back and help the other people coming behind you, and everyone has something to give. Like, Ali, I'm just hearing you talk about trauma therapy and embodiment practice. I'm like, I'm following up with her. I'm getting her book recs. I want to know. So before you go, you can give me those tidbits. But yeah, I do think there's something there about, just knowing that you can get through it, whatever's coming your way.
Amazing. Well, Ali, where can people find you and follow all of Ali posts these like great day in the life Costa Rica videos, and like legit lives in a jungle. So if anything, follow her for those videos because they're so fun to watch. But yeah, how can people follow you, find out more about your work, find out more about your pregnancy, about endo, about all the things?
I am going on my maternity leave at the end of July. So my goal is to hopefully be back practicing by January, because no one wants to work on their health during the holidays anyways. So as far as that goes, still though, I would say my Instagram is like a hodgepodge of like, I used to have a personal one and I was like, I can't do this two thing. Like that's way too much for me. So yeah, I talk about all the things, the jungle, my zoo, IVF, pregnancy. It's that gal Al on Instagram and TikTok. Sometimes I make unhinged videos about my feelings and then that pops off. So yeah, that's where you can find me.
Amazing. And I'm hoping you're going to document a lot of the process of, because you just got back from California for a check, like just like a check-in with your OB.
I don't have an OB. I have just a team of midwives. We're having our baby in Sacramento. So I'm booking my flight today. That's insane. My one-way ticket with my cat to Sacramento at the end of this month. And then my idea is that I will be there, hopefully, depending on how long it takes to get documents and a passport these days, till probably end of October would be and then I'll come back. But yeah, I'm plan on, continuing the documents, the ups and downs of traveling, and kind of at this point living between two countries, which is like weird to say.
Yeah, so wild.
Just an added
element. What is your practice called, Ali?
Nueva Rama Wellness. It's kind of a play on my last name, but it means new branch in Spanish. So like turning over a new branch.
That's beautiful. I just appreciate the honesty and, telling it like it is. I think that is something we've wanted to do as a part of this podcast, and really not shy away from the whole process, the holistic, what you're talking about, like the whole thing,
the whole picture.
And so thank you. The whole picture. Yeah. It's not just like I'm a warrior and I got through it. It's not just I have a happy ending. It's also not just sad, right? And depressing. It's all of the things. And so, I really appreciate you coming on.
Yeah.
Thanks so much, Ali. And we will talk to you all next time. And as a reminder, you're doing great.
You're doing great.
Doing great. Yay.
All right. See you later.
All right. Thanks, Ali.